Hi, I'm Audrey Chapman. I usually say every Saturday, how's your relationship with yourself? Did you know this question has to do with your self-esteem and your self-image? Some people refer to self-image as your self-concept. They have to do with hair, skin color, texture of hair, body shape, breasts, legs, size, hips, all those kinds of things that we are constantly checking and worrying about. But more often if you're female, but I think guys worry about these things too. So, did you know that the inside plays a role with the outside? A lot of people don't realize that. We're talking about self-esteem today, and whether you think the inside or the outside in any way influences your self-image. I have a couple of people here to help us out. The first is Dr. Yolanda Ragland. She is a podiatrist surgeon who is a CEO of New York-based Fix Your Feet, which also has a location in Silver Spring, Maryland, and I've heard of this place. The second doctor is Dr. Emeka Onyewu. He is a board-certified plastic surgeon as well as the founder of medical director of Jamachi Meaty Spa in Silver Spring, Maryland. Jamachi. All right. We are here if you'd like to get in on the conversation about your self-esteem, and I'm going to define self-esteem for you, or about your self-image. Parts of your body that maybe you don't feel good about, that you would like to do something about. Maybe it is your feet. Maybe you feel like you have the worst feet in the world, and that's why you hate to go and get a pedi every now and then. The number here is 202-319-7810. That's 202-319-7810 or 1-855-288-HURN. That's 1-855-288-4876 if you'd like to get in on the conversation. Welcome to the Audrey Chapman Show. You're on the air.
Good morning. Hi, how are you?
I'm fine. How are you?
I'm good. I'm actually a former patient of Dr. O's.
Okay.
And I had huge problems with self-esteem. Just the way that my dresses would lay on my side, I guess he calls those love handles. And I went in recently and I had operations to correct it. I'm extremely happy with the results.
Okay, so what did you have done?
It was lipo.
Lipo. Okay.
Yeah, and so I went in, I'm just like, I have this huge stomach, and he's like, you don't. And, of course, what I felt and what I saw was not what he saw or has seen in comparison to, I guess, other people. He showed me some pictures, and I'm very adamant, and I'm like, I have a huge stomach, And so we did the lipo. I do work out. Life is really busy, have 2 teenagers, always on the go. I'm single, and for me, they're almost out the house, and hopefully, I won't always have this problem, and maybe I won't stay single. So I was very happy with the results. He did the lipo, and I had a scar, which prevented me from wearing certain clothes. It was on my abdomen as well, and he corrected it. It's only been 3 to 4 weeks, but I've already seen mass improvement.
So that also probably influences what you're able to wear now. I would think is very different.
It definitely does.
Yeah.
And even yesterday, I was out and got a couple of horn honks or what have you, and I was like, wow! I got to go back and tell Dr. O's staff I'm not even healed yet, and I'm already on the go.
All right. Well, we thank you so much for calling in, and I'm going to have you refer to him as Dr. O. I'm going to have him comment on what you've said as soon as we come back. But thank you so much for calling in.
Thank you. Have a great day.
You're welcome. Take care.
Thank you. You too.
Well, did you know that self-esteem is more than just merely recognizing one's positive qualities? It's an attitude of acceptance and non-judgmental toward yourself and to others. How well do you accept the way you look? Give us a call. We're talking about whether self-esteem happens from the outside in or the inside out. This is the Audrey Chapman Show, continuing on 96.3 WHUR and HUR Voices, Sirius XM channel 141. Yeah, we know beauty is only skin deep. That's attempts. They knew that, and their routine showed it. This is Audrey Chapman, and we're talking about self-esteem this morning. Is self-esteem more an inside job? I want you to call and tell me. Or do you think it's better just to focus on the outside and make sure you clean up the self-concepts, or what we're calling today your self-image? I'd love to know the answer to that. Self-esteem has many building blocks. Obviously, you have to have unconditional worth, and you have to have unconditional love for yourself, and you have to work continually on self-growth and development, which means that you're looking for all kinds of ways to be the best person you could ever be. My guest today is Dr. Yolanda Ragland. She is a podiatrist surgeon who is a CEO of Fix Your Feet, which has locations in New York City and Silver Spring, Maryland. So if you're listening from New York, you know that you can go and get your feet done. And Dr. Onyewu, who is a board-certified plastic surgeon, as well as the founder and medical director of Chapman Medi Spa in Silver Spring, Maryland. Did I get it?
You got it.
All right, we're here at 202-319-7810, 202-319-7810, or 1-855-288-HURN. That's 1-855-288-4876 if you want to get in on this conversation. I also want to remind you guys that you can join me on Facebook, Audrey Chapman Show, and also Twitter me on Audrey Chapman 13. I'd love to hear from you. You can do that now if you'd like. All right. So you had a patient, Dr. O, call about her body image. And what did you do for her?
Well, she came in complaining about her belly being too big and her love handle, so that's the fat at the sides, sort of just above your waist. Mm-hmm. And as she said on the air, she thought it was just horrible, and that's a typical story. A lot of patients come in and they don't even want to show me what they're unhappy about because they just think I would be disgusted. And sometimes you find out that they really don't look that bad. Obviously, I see a lot of patients in the big scheme of things. They're really not.
So there's sometimes going to be a distortion of how you look.
Absolutely.
Right.
Absolutely. And especially if it's something that you're fixated on, or that you've just focused on it for so long, it just seems to be this monumental deformity. I mean, she had some fat and probably no more than a typical person in their mid-40s. We did liposuction for her and got rid of the fat and got rid of the love handles, brought her waistline back in, and just gave her back the shape that she probably had 20 years ago, and she was happy with that. But I think trying to figure out the motivation, like why people come in for the problem, helps me, because the last thing I want to do is to change something physically and find out that the issue isn't even the physical.
Yes, because obviously in my business I see people who have such disdain for themselves. They don't like themselves, and so no matter what you do with the outside, if you're not dealing with that part, they're going to find something else that they don't like, that they want to reject. So you have to, I think it is important to,
absolutely. Or they're unhappy.
To understand the two things.
Yeah, they're dissatisfied. So you do all this work and you think you've done a wonderful job,
right,
and they come in and they're still unhappy.
Right.
So I try to take some time during the consultation to figure out why do they want to change this body part. A lot of times
important.
They're unhappy about, could be a relationship or a marriage or
Sure.
a recent divorce.
Sure.
And the first thing they can change is something physical on the outside. It's sort of the easy way out
Sure.
to solve the problem.
Absolutely.
And so you kind of want to make sure that that there's not an underlying issue that you're not going to take care of by changing them physically.
And we're a society that likes to do the easy thing or have somebody else take care of it instead of us kind of taking some responsibility for ourselves.
Oh, yeah.
How safe is liposuction? Because there are all kinds of rumors about it not being safe, and I think it's important to raise that.
No, it's a legitimate question. There have been some deaths from liposuction in the past. I mean, they're very rare. In the United States, about 400,000 cases of liposuction are done every year, and there may be one or two deaths. And I think if you look critically at those particular cases, they're all in patients who have other medical problems, so underlying heart disease or lung disease or smokers, and they're always in cases that have high volume liposuction. So somebody comes in one day, they want to do the belly and the sides and the thighs and the back.
They have too much done.
Right, too much done in one day in a patient who already has pre-existing medical problems. But if you take that subcategory out, it's an extremely safe procedure with virtually not only no deaths, but very little morbidity, very little even non-serious problems associated with it.
Okay, I just thought that was important to get that out there.
Oh, yeah.
And I'm surprised someone hasn't called yet to ask you that. But all right, so we're going to take the next caller. Welcome to the Audrey Chapman Show. You're on the air.
Hello, good morning.
Good. Hello, how are you?
I'm good. Good morning, Dr. Chapman, Dr. Ragland, and Dr. O. I'm a previous patient of Dr. Ragland's.
Okay.
And I had both of my feet worked on at the same time. I had both feet had bunionsectomies. I had my second toes shortened on both of my feet.
Oh, you can shorten toes?
Huh?
I said you can shorten toes.
It's part of the correction.
It's part of the correction, yeah. But before I had the surgery, I definitely did not attend any pool parties. And I was actually married to for 4 years, and he's never seen my feet.
Oh.
And I never went out the house. So my pocketbooks, my job, everything were full of socks. I have over 300 pairs of socks.
So you never wore sandals in the summer?
I did, but I only wore peep toe.
Okay.
And closed in sandals.
Okay.
So nobody got to see them.
Right.
And once I went to Dr. Ragland, I've thrown away all my peep toe shoes. And the thing I like about my surgery is even with me having surgery on both of my feet, unless I tell you, you won't know what happened.
Wow.
No, there are no visible scars.
So there are no scars.
Right. And what I do also like about it is my sister-in-law went and had surgery just on one, and her scar is so noticeable, and she's so jealous of mine. But yes, I've had them on. She's actually worked on all 10 of my toes, and neither one of my toes you can see where the surgery's been.
Wow.
So
do you want to jump in, Dr.
Well, obviously we got like a perfect result, which doesn't always happen. I never guarantee it, but I always try my hardest. I aim to please, and I try to get the sort of results that this patient got.
Wants,
yielded, this is the reason why a number of the patients elect to see me versus other doctors is because the doctors will say, yeah, I can fix your problem. I can get rid of your pain. But if you're looking for cosmeses, I'm not a plastic surgeon. That's not what I do. Early on in my medical education, I decided not to be that person. I said, take a little more time, think about where you're going to place the incisions, have strategy towards it, learn how to use the closing procedures and techniques that a plastic surgeon would do. And just become super specialized so that because I knew that there were so many people out there that wanted this sort of result. So I do the same standard orthopedic procedures that have lasted the test, lasted the test of time. I'm sorry, I'm getting all flustered here. But I've done these standard orthopedic procedures that all the other surgeons do. However, like I said, my incisions are strategically placed. And like I said, when I close,
makes a difference.
It makes, and the materials that I use, I make sure that I don't use materials that will react with the skin so that you don't get a big, huge scar. Now, sometimes you do all of this and you still get, you don't get the best scarring.
What if you have, if you keloid? Because that's certainly something, I had to have surgery many years ago. and they didn't bother to tell me that I might keloid from it, and I ended up with a huge keloid scar, which I have dealt with. But anyway, what about that?
Well, first you have to find out. You have to determine whether or not is it really a keloid. There are keloids and there are hypertrophic scars. Okay, and a keloid usually grows beyond the incision lines. It bubbles over. So first right. Or versus a hypertrophic scar. Now, hypertrophic scar could just be due to how it was closed. It just wasn't closed with the same amount of care. So you might get a hypertrophic scar in emergency medicine.
So,
yes.
But my question was, how would you know ahead of time? Is there a way to? I don't know if there's a way.
Well, you ask when you're doing the history and physical.
Oh, you ask the patient.
Oh, yeah, you'll ask them if they have a history of keloids. Some patients will, and that's why I was saying, patients will tell me, yes, they do keloid, and I'm like, show me your keloid.
Okay.
And then I look at it and I say, that's not really a keloid.
Okay, so you're able to tell the difference.
Right.
And assure the person.
Right,
and
exactly.
Okay, so that's did you want to add anything to that before we go right to the next person?
Yeah, just real quick, it's very difficult.
Thank you, caller.
Who's never had surgery before to know whether they're keloid or not. And I think that and I tell patients that it may be because I have a lot of African American patients. It's always on my mind.
Right.
So it's part of the discussion that you may not. And the fact that you've keloided in one part of your body doesn't mean you'll keloid in another part of your body. And the fact that you didn't doesn't mean that you won't.
Right.
But there are a lot of ways to treat keloids these days, and especially if you identify them early and you start the silicone strips, you start the Kelog injections, you can even do radiation. So there are lots of ways to treat, and that's kind of part of the counseling I give patients ahead of time, so they know this. Don't be scared, and if you notice it early, come in so we can deal with it.
Wonderful. All right, we're going to try to squeeze a caller in before we go to break. Welcome to the Audrey Chapman Show. You're on the air.
Good morning, Audrey.
Good morning.
I want to start off by saying that I was 27 when I got full plastic surgery.
Okay, what do you mean by full?
Well, I had got Brazilian butt lift, I got a tummy tuck, I got lipo on my stomach and back, my on the bottom of my back, my flanks, and also my legs.
Okay.
And the reason being is because I'm an African-American young lady, and it started off because I always had a flat behind.
Oh.
And I've heard that all throughout my life. Oh, your butt is flat for a black girl or what have you. So I think my self-esteem came from the outside in.
Mm-hmm.
So with that being said, I decided, and I have 2 kids as well. I'm a young woman with 2 kids. I'm not fat. I'm 5'4", 130 pounds, but I wanted a butt. So being as though I was going into surgery to get the Brazilian butt lift, I said, you know what? I might as well do everything else. Slim waist, big butt, right? So at the age of 27, I got everything done, and that's because of my self-esteem from everybody saying something to me, people saying something to me throughout my whole entire life. So it was my behind.
Okay, so you became self-conscious of that. And did Dr. O work on you? No.
No, he did not. I had a different doctor in Baltimore who did.
Oh, okay. All right.
And satisfied with my results, happy about it.
All right.
And it's like I never had a problem with getting a guy or anything, but now it's different. Like, I mean, people just looking at from everywhere now.
And did you have all of those surgeries done I was just thinking back to what Dr. O said earlier. Did you have them all done at one time, or did you?
Yes.
Oh, you
I
did?
had everything done at one time. I think I was under for about 8 to 9 hours. And I heard him say that when you get a lot of stuff done, you're more prone to, problems.
You're at risk.
Right. And no, I'm fine.
Well,
a good thing.
We're so happy to hear that. But I held my breath when you said 8 and 9 hours.
Yes, I was under for a long time.
That's all right.
So the recovery after the surgery was horrible.
I'm sure.
Yeah. So.
Okay. All right. Well, thank you so much for calling. Dr. O, do you want to say anything?
Just briefly, in a 27-year-old with no medical problems, an 8-hour surgery is not that unusual. Some doctors would split it and would have done half in 3 or 4 hours and come back a few months later. But in a 27-year-old, they probably could handle that. So I don't want everybody to feel that, if a doctor says I can do it all at one time. I think if she had...
However, if she were 55...
If she was 55, if she was on high blood pressure medicine, if
diabetic,
she was a smoker or had some diabetes, then absolutely it wouldn't be recommended. They would have split that into 2 different procedures.
We would hope.
Exactly.
Yes, all right. All righty, we're going to take, the next caller. Welcome to the Audrey Chapman Show. You're on the air.
Good morning. Thanks for having me on the show. My name is Sue. I'm calling from Olney, Maryland. So I'm a believer that beauty comes from the inside. It's a passion of mine. I believe that women, regardless of their age, their size, whatever, they're fabulous creatures. So this is a question for Dr. O. At what point do you sort of play the part maybe of counselor, or do you identify that a patient has internal issues with self-esteem? For example, a patient that comes back over and over again for different surgery, maybe it's the eyebrows today, tomorrow it's the hips, the next day it's the stomach. And then you realize that there's something going on with this patient. I mean, obviously, you would never discourage them, because I understand it's your livelihood. But at what point do you say, let's hold on, there's a problem here, and help them to identify that regardless, that they're made beautifully. I mean, some women are fat and they're happy. Some people are skinny and they're not happy. So I don't think it's necessarily size. I'm also enhancing what you have, but sometimes I really believe that there's an issue. So I don't know if you have any thoughts on that.
That's why I think when people want to have the gastric bypass, they have to see a psychiatrist, because they want to make sure that there isn't something also going on. There are people that have distorted body image. It's in the DMS-4. It's a condition, and so you have to make sure that that's not also what's going on. So, but I'm going to let Dr. O.
Sure. I think it's a great question. The first thing I think is how realistic is what you're trying to do, and that gives me sort of an insight into your motivation behind doing. So, for instance, if somebody came into me with a picture of Janet Jackson and said, "I want to look like this," but they're 5'2" and 200 pounds, they already are starting off without realistic expectations, and usually there's something else going on, and that person, obviously, I wouldn't do the surgery. It is my livelihood, but short term, if I did everybody who walked in, it would help me, but long term, it really wouldn't, because I would have unhappy patients, and I wouldn't really be solving or helping them. So you're right. There are people that come in, or if they come in your second and third time, and every time you change something, they have something new to change, I would start to question why they're doing that. And I would talk to them. I mean, we talk about things during the consultation other than just physical things. Where are they? Where are their kids? What's going on at home? So we talk about some of these things. But there are a lot of people, and by far the majority, have healthy desires. It's just like, I guess I would say, people do their hair and they put on makeup, and because those things are not invasive, we think they're okay. But there are surgical procedures that are minimally invasive that help people. Supposing you have wrinkles in your forehead and you look angry all the time, and you just want to get rid of that. That's not necessarily telling me or the world that you're unhappy, or you think you're ugly, or your body image is terrible. It's just that you have something that you feel can make you look better, that can enhance your looks. And so 80% of patients fall in that category, where they have one or two things that they think if they could alter, they would look better. They would be presenting themselves in the best possible light.
All right. Thank you so much, caller, for calling in. We appreciate that. We're going to try to squeeze another caller in. Welcome to the Audrey Chapman Show. You're on the air.
Yes, I just wanted to know, does this have anything to do with being in the minority and a majority society, where the image of the majority was seen for many, many years and was pushed to look like someone else, that we have developed some of these images, body images?
Well, you're talking about the media and I guess media magazines and places like that, where the so-called beauty was the hourglass shape Caucasian blonde woman. I think that's what you're referring to, and how the many women from other cultures. I mean, if you go to Brazil, you see very interesting body images, very close to African American women, and that as a result of that, the stereotype of black women being bulky, lack of a better way of saying it,
Curvy, yes.
Curvy, and not necessarily accepted by the traditional look. And I think that's what you're alluding to. So you're saying, does that have anything to do with women getting surgery? Is that your question?
Well, not necessarily getting surgery, but not being satisfied with...
not being satisfied. Mm-hmm.
Yeah.
Oh, it can. There's an element of it that certainly can. But I would not say 100%. It is possible that this particular concept, such as Dr. O's patient that called in earlier with the stomach and the love handles, that was really affecting how she felt about herself. And so that wasn't just made up, was it, Dr. O?
No, absolutely. And not only that, but I think what people consider beautiful or desirable changes. You know, Nicki Minaj came, and now everybody wants to go in the opposite direction. So it changes really year by year, decade by decade, and really that skinny figure 11 straight down shape is not even popular now anymore.
Mm-hmm. Yeah. So I hope we answered your question, and again, I think what's really important is how you feel about it, whatever it is, whether it's your feet or your body or your hair or whatever, that you feel good about it. All right. Well, believe it or not, we are down on time. And again, I want to thank you all. I did warn you it would go fast. I want to thank Dr. Yolanda Ragland, Fix Your Feet, in Silver Spring and New York.
Thank you for having me.
You're very welcome. You have a wonderful smile.
Thank you.
Dr. Amika Onyewu from the Jamachi Midi Spa. I want to thank you for joining us as well and helping us to understand our bodies.
It's my pleasure.
Okay. I'm going to keep taking your calls, and we're going to keep talking about self-image and also self-esteem as we continue exclusively on HUR Voices Sirius XM Channel 141. I want to remind you that now on the blog is the first Love Lesson 101, and it's on improving your sexuality. So if you're interested in that, go to WHUR.com, go to my show blog, and you'll see the love lesson there. Again, you can call me for the show, 202-319-7810, or call me at 1-855-288-4876 if you want to get in on the next hour. Thank you for tuning in. Stay connected with me through audreychapman.com. That's the website. We do have counselors there that can help you out, and my information is there as well. You can also go to the show blog, check out the new Love Lesson 101. You can also send me your love letters. That is WHUR.com. Again, I want to remind you that you can check out Audrey Chapman Facebook page and Twitter, Audrey Chapman 13. I want to thank my producer, Teresa Caldwell, my technical producer, Craig Fowler, our engineers, Terrence Jackson. I'm Audrey Chapman.